Good morning, everybody, and welcome to our webinar of this morning. This morning, we'll be talking about drafting for compliance and the best practices in the health equipment standards. My name is Elsa. I'm moderating the webinar in the background, and I would like to introduce a bit the housekeeping rules for today's webinar. So by default, all the attendees are muted, but you have the possibility to raise your questions in the Q&A panel. So please use that panel to submit your questions, and then the speakers can have a look at the different questions that come in. We are recording this webinar, so we will provide you with the presentations and the recording afterwards. Should you be on our social media, we're not only on Twitter, which we call X today, we're also on LinkedIn and Blue Sky, so please feel free to tweet about it with the hashtag Training for Standards. So without further ado, I think I can hand over the floor to Mario from the European Commission, who is connected with us today. So thank you, Mario. The floor is yours.
Thank you, Esther. Thank you very much. Good morning, everybody. So my name is Mario Gabrielli Cossello. I'm the Legal and Policy Officer in the European Commission Services in charge of medical devices, the Director General for Health and Food Safety, DG Sante. In particular, I'm dealing with the standardization issues in support of the regulations on medical devices and in vitro diagnostic medical devices. So indeed, I welcome very much this initiative to have a direct forum between the experts in CEN and CENELEC technical committees in charge of developing standards, in particular harmonized standards, and let's say all interested people in the standardization process, and indeed with the participation of a couple of us consultants, those experts working with the Commission in order to support the Commission services in assessing draft harmonized standards intended to be cited in the official journal to provide presumption of conformity. So indeed, I will be very brief, just to mention indeed that this is the first of a series of training for the technical committees. The first one on healthcare standards, so those in support of the regulation of medical devices. We are in a not easy situation right now because we need to clarify some procedures with respect of the publication of harmonized standards and the relationship between the Commission and the European standardization organizations. But indeed, it's very good to have this opportunity to clarify some practical issues when developing harmonized standards and when assessing them. So we have, of course, all of us have a common set of rules and procedures. Rules, of course, stemming from the regulation themselves, from the standardization request governing the need for developing certain harmonized standards in support of the requirements of the regulations, and a set of procedures agreed between the Commission and CEN and CENELEC, as well as the internal procedures, internal rules of CEN and CENELEC themselves. So the rules in principle are there, are more or less clear, I would say, but then the practical application will need a continuous effort to find the right way to work, to clarify any possible or prevent any possible misunderstanding, and to ensure that a pragmatic approach is taken by all the actors, of course, always respecting the legal rule and the procedural rule, but avoiding also to remain too much formalistic, too much stuck to a very formal interpretation of the rules. We have always to remember that these standards are very useful, are addressed to the whole community of sectoral actors, in premise, first of all, the manufacturers, but also the notified bodies, the conformity assessment bodies, when carrying out the conformity assessment procedures, and also market surveillance authorities when they need to intervene, if necessary, in assessing devices placed on the market. So it's the utmost importance to develop good standards, not only from a technical point of view, but also from a legal point of view, and also considering the readability and usability of these standards. Again, thinking on the final users of these standards, which in many cases are not really expert on technicalities or legalities, let's say, but they just want to have clear and useful standards to apply for their devices intended to be placed on the European market. So I close here. Thanks a lot again for this opportunity. I will follow up actively the training of today, and of course, happy to contribute where necessary. Thank you.
Thanks a lot, Mario. Good morning from my side. So I'm Frédéric Mlanao. I'm an account manager at CEN and CENELEC, and I will take part. I will give a presentation related to the key reminders related to processes and some drafting reminders. I will quickly go back before we continue to the agenda because we went too quickly over it. So I will take this part. So reminders about key development processes and drafting reminders. And then EY, the HAS support team, will give a process overview and a sector update. And then the core of the webinar today is about best practices and recurring issues. And we have two HAS consultants with us today. And as well, you will have the opportunity to have an extensive Q&A with the HAS consultants and with all of us. So I will go to my part about some key reminders related to the development processes and drafting. The goal of the presentation today is not to go deep into those processes and drafting reminders. It's just to give an overview and to invite you to follow the webinars and the guidance documents we have available for you. So for the innovative process is targeted to homegrown to standard developed only at European level, so homegrown standard. And the target of this new process that is in place for almost 2 years now is to increase the number of compliant assessments and at the end, possibly the number of standards cited in the official journal. I think you know the process very well now, but to remind, it's based mainly on two main pillars. The mature draft concept, that is a draft that is ready to be circulated for inquiry. And now the mature draft assessment is mandatory. And I insist on that, this is mandatory. Before there was the optional first working draft assessment. That is not possible anymore. Now the mature draft assessment on the mature draft is mandatory. And you still have the possibility to have a first working draft circulation, but the first working draft assessment is not possible anymore. The second pillar of this new process is the CCMC quality check. And the goal of this quality check is to help you, technical bodies, identify elements in the draft or in the annexes that could potentially lead to a lack of compliant assessment. And for performing this quality check, we use the common checklist as a support document. That is the same document that is used by the HAS consultants when they are performing their assessment. This is the timeline of the innovative process for homegrown. So I will move my cursor. Yes, so here, when the mature draft is ready, and it's up to you, TC, to assess if your draft is ready to be circulated for a query. But when it's ready, the first step is the CCMC quality check. So here you have to notify CCMC that you need to have a quality check performed on your draft. We perform the quality check. We send it back to you. There you have 4 weeks to take into account the comments received during the quality check to update your draft. And then following that, when the draft comes back to us, we request the first assessment, the mature draft assessment. After the assessment, you still have some time to address the comments from the HAS consultant and to organize a meeting with the HAS consultant. And then the inquiry phase starts. Here you see there's the possibility to have an inquiry assessment that is optional. But most of the time, there's anyway a lack of compliant assessment on the mature draft, on the first assessment. So this is kind of by default requested. And then on the second part, there's the second quality check on the pre-formal vote draft. Same thing, it's a draft that is ready to be circulated for formal vote. And then following the quality check, you have time to update your draft. And then there's the pre-formal vote assessment. After this assessment, we hope that since we start earlier and you have the opportunity to exchange with us consultants, we hope that you will get a compliant assessment at formal vote. But if there's a lack of compliant assessment, at formal vote, you have the possibility to request a last confirmatory assessment at LCA. And you can see here that everything is done before the formal vote ballot starts. Here it's a recap and it's operational instructions for you to explain you how to contact CCMC to request the quality check and what are the steps. I will not go through these slides. This is more for you here in the presentation for information. Now about when to request an assessment. So it's still maximum of 4 assessments per work item. You will see that, by the way, EY have kind of a similar slide in their presentation, but I still wanted to talk about this one. So major draft, the inquiry assessment if there's a lack of compliance on the major draft, and then the pre-formal vote assessment, and then if there's a lack of compliance at formal vote, there's the last confirmatory assessment. So again, maximum of 4 assessments per work item. The LCA is a full assessment, but we hope that will become exceptional and we will use it less and less. And it's not possible to request an assessment on a published standard. EY has the possibility to perform an assessment upon the request of a desk officer, but from CCMC, we cannot request an assessment once the standard has been published. Now, I will go to the project developed in parallel, because in the health sector, there are a lot of projects developed in parallel. What is key for standard developed in parallel is the consensus building at European and international level. And what is really key as well is a strong communication and coordination between the European TC and the international TC. And so the big advantage of harmonized standard developed in parallel is that the same standard hopefully applies worldwide and in Europe, and provides presumption of conformity to the European legislation. We have developed as well kind of a new process for parallel projects. The process is in place for a bit more than 1 year now. And same as for the innovative process, the goal of this new process is to improve the timely delivery of parallel documents to avoid having blocked standard before the publication. It still happens that because there's a lack of compliant assessment at LCA, the project is blocked and we cannot proceed at European level, while at international level, the project is published. And as well, important element about the new process for parallel, we want to minimize the impact on the international project timeframe. And so this is the new process for parallel. So it's very, very similar to the normal process for parallel development, I would say, except that we focus here at the beginning. Same idea as the innovative process. We want to start earlier to have the possibility to fix the issues before the end of the development. And so for the new process for parallel, we focus on the CD stage. If there's no CD stage at international level, there's no new process for parallel. If there's a CD stage, and if the CD is above 8 weeks, so if the CD is 12 weeks, then we have the time to perform a quality check on the European elements. And as well, now there's a mandatory assessment at CD stage if the CD is available. If the CD duration is too short, instead of performing the quality check, we decided to directly request a CD assessment so that the TC can directly have the feedback from the HAS consultants. So what is really key here is if there's a CD at international level, then the new process can act. And depending on the duration of the CD, there will be a quality check on the European elements and the mandatory assessment, or only the mandatory assessment. So some key points for the development in parallel. You should start the process as early as possible. And so the European TC is invited to really closely follow the work at international level so that the European annexes could be developed in parallel with the CD draft, so that when the CD draft is ready, all the elements are available for performing the quality check and requesting the CD assessment. So as I was saying, the new process applies only if there's a CD available, and as well if the European elements are available. Without the European elements, the Annex Z, we will not be able to request the assessment. So again, insisting on the importance of starting early and the coordination, the third bullet point, coordination and communication between the European TC, the CEN/CENELEC TC, and the ISO ICTC. Last important element is the common checklist. It is not mandatory to perform a self-assessment on a standard developed in parallel with ISO and IC, but I highly insist on the importance of using the common checklist, because this will help you perform the self-assessment, and this will help you check what are the elements that the HAS consultant will check for his or her assessment. So please use the common checklist when drafting your standard and when filling in your Annex Z, sorry, the common checklist is key. And then finally, some key drafting reminders. So again, perform the self-assessment using the common checklist, even if you are working on a standard developed in parallel. Please draft clear and verifiable provisions. I don't remember if there are some examples today about that, but it's a common issue we see. And if your requirement that is supporting the legislation is not clear, there you have an issue. Important reminder about the normative references. We used to have a lot of issues with that. Now it's better thanks to the new processes and the quality check, but still, the normative references should be dated, active, and published when the harmonized standard is made available. As well, it is highly recommended to refer to a specific clause within the normative reference. That way you will avoid issues with the chains of normative references. And finally, please use the CCMC guidance documents. I have put the link here to the both pages. I know we have a lot of documents, but please have a look at them, because this will really help you understand the processes and understand the rules to help you draft better your standards that are in support of the legislation. My last slide is a lot of useful links, but those links are essential. It's links about drafting rules, the use of normative references, about the processes, the use of the common checklist, the table ZD2 in the Annex ZD. So very important information. You have it there. Please take some time to have a look to those presentations. Voilà, that's it for my part. If you have questions, I don't know if you should go now or if we should wait for the Q&A, but you can contact me anytime you have questions. And now I will leave the floor to Dan for the EY part. Dan, are you?
Yes, Dan should be with us.
Sorry, I am there, but I was not be able to find the screen. So, but yeah, we can proceed.
Do you want me to keep sharing the screen?
Yeah, if you can, our slides are on there as well, right? So I can control it.
I will. Yeah, just 1 minute. I will change the presentation.
Thank you. Can you provide me the control, or will you control it?
I will provide you the control. Okay, I will control it. Let's go there.
Okay. Please move on to the team slide. So thank you very much for joining us today. My name is Daan Bijwaard. I'm the team leader of the HAS project. So on the side of EY, I'm responsible for the day-to-day project management and implementation. I'm joined here today by Emilia and Milko, who are working on the operational implementation. So I think if you have requested a meeting, for example, you will have been in contact with them. Also joining here today is Václav, who is part of our QR team, so the quality review team. I will perform the horizontal checks, which I will also refer to later on. And of course, which you can see on the next slide, we are joined today with the HAS consultants covering your sector, so the healthcare equipment sector. This includes Christoph Kieselbach and Daniela Loy, who will present, let's say, the more technical part of the presentation later on. And I also saw in the group meeting that I think most of the other consultants covering your sector are here present in the meeting today, and they can of course participate later on in the discussions, and because that's an important aim of today's meeting, to have discussions, to engage. So on to the next slide. So it's great to see that many of you are attending. I saw over, well, even 94 people now in the chat. So that's great. And thank you for CCMC providing this opportunity for us and for the HAS consultants to engage with you directly. We know that the HAS system is important to your work and affects your daily work. Yeah, I think it's of crucial importance to learn from each other and cooperate. So today's workshop, was already mentioned by Frederic, is the first, and Mario as well, is the first of a series we are providing. As you can see on the next slide, we cover currently 23 sectors, if I counted it well. Healthcare equipment is actually among the largest ones. It's the third largest, if you would count noise and machinery as one sector. So then healthcare equipment is the third largest sector. In terms of overall assessments performed since the start of the project, so the start of the current project, the contract started in 2022. Since then, we have completed over 200 assessments in the healthcare equipment sector. So it's clearly a sector of key importance, and that we also took into account for organizing this meeting. So this is the first one, and a whole range of the other sectors will be covered in the weeks and months to come in similar meetings. But today we kick off with healthcare equipment. So before we provide some operational figures on the current state of play, I would like to reiterate what the HAS project is about at its core. As you can see it on the next slide, we perceive it as a service, or it is a service in our view. A service, of course, I mean, we as contractors carry out for the European Commission as contracting authority, but it's also, and it should be, a service to the technical bodies in CEN, CENELEC and ETSI. And the aim is to increase the compliance of harmonized standards with the legislation, and as such, ultimately increase the publication rate of the standards in the official journal. So to have more harmonized standards available for organizations or manufacturers of medical devices in your particular case across the EU. But the latter and the increased publication rate was achieved during the last contract. We have similar indications now, and that's something we will try to build upon. So the main objectives of HAS, to summarize, are that typical compliance concerns are identified to reduce non-compliance. On top of that, we provide targeted training support to HAS consultants, the ESOs, as well as the commission services. So this is part of this task, what we do today. support the Commission in its efforts to reduce the number of non-cited harmonized standards in the official journal, and ensure that, and that's of course the typical task of our, let's say, operational team, to ensure that the HAS consultant resources are dedicated to the actual assessment work, that they have the means, the documents, the time, etc. needed, the information needed to carry out an assessment. So the next slide shows what an IR looks like from an assessment request looks like from an operational point of view. So you have the CEN CENELEC internal checks, the self-assessment. Then we receive an assessment request. We allocate the work to a HAS consultant and ensure they have the information needed. Consultants can obtain the normative references from the platform of CCMC. The HAS consultant performs the assessment, he or she sends it back to us. Our quality review team performs an horizontal check, which has an outcome is a red, yellow, or green light. So if the red or yellow light means that there are some horizontal issues with the quality of the assessment, so then the HAS consultant will address this. If given the green light, we will send it on to the standardization organizations and the Commission. And then after this, there is the opportunity for the technical committees to have a meeting in which the consultant will explain the outcomes of the assessment. So on EY's part, this whole the KPI for us is to perform this entire process in 35 days. So from receiving the assessment request to sending it back to the ESOs and the Commission. So what to expect from a HAS assessment? You will see it on the next slide. So what's the role of a HAS consultant? So obviously the consultant performs the assessment. He or she works in support of, but does not represent the European Commission. They are contracted by UI. They can convey to the ESOs in meetings the Commission's positions to the ESOs or the technical bodies. Important to mention is that they are not allowed to modify their reports or assess revised documents during meetings. So meetings are there to explain the assessment outcomes. The meetings are not there to, let's say, together develop a standard. So that's all meant to ensure the, let's say, the independent position of the HAS consultant who carries out the assessment. And last but not least, it's also important to mention that the Commission, for its ultimate decision to publish or to cite the standard or not, is, of course, considers, and that's what the system is aimed at, but is not bound by the results of the assessment performed by the HAS consultant. As mentioned by Frederic, HAS consultants can assess the assessment at 4 different stages, if excluding the stage in which the Commission can request a request just before citation. So these are the 4 stages of committee draft inquiry, formal vote, and last conformity assessment, when USTCs can request and are strongly encouraged, of course, to request assessments. You will see in the next slide for the healthcare equipment sector when this was done so far. And so you see that most are requested at inquiry stage and formal vote stage. Large conformity assessment fewer, but there is also not need to do if there's a positive outcome at formal vote stage. And what we always and have been doing for the last couple of years have been saying is that to TCs is that please request your assessments as early on as possible. And so you're strongly requested we're strongly encouraged to ask for assessments at the committee draft stage as well. So we see across sectors that this figure is going up, and so we see more and more early assessments, which we think is a positive sign. To show you could make maximum use of the system. So in case of lack of compliance, you must wait until the next stage to submit a new request. So there are no 2 requests at the same time. or at the same stage. In between two assessments, you're requested to you can request a meeting. So also here you're really encouraged to do so. So the number of meetings so far has been quite low under this contract. We know that there have been some misunderstandings from TCs. Not all think that meetings are actually allowed, but there are definitely if they adhere to the criteria. I will come back to that later on. If there is to provide information, which is basically the main criterion, then this is definitely possible and also encouraged. So on to the next slide. So this is to give an operational overview of where we are. So this is a timeliness overview. So as I mentioned, for us as EY, the key KPI is to deliver an assessment report within 35 days from receiving it from CEN and CENELEC, so send it back again in 35 days. So the dark green is here the percentage that is delivered in this time frame. So as all of you know, at the beginning of the contract, we started with a large backlog, which impacted the timeliness. We have worked a lot on well, eliminating the backlog. First of all, there's currently no backlog, so all assessments can be are allocated immediately to a HUD consultant. So there are no important delays. So if you see also for 2025, the great majority of assessments, 80% in the last quarter that was completed. 80% of these assessments were indeed performed by the HUD consultants and sent back to the standardization organizations within 35 days. So this is only for the healthcare equipment sector. You see a similar picture across sectors. Of course, the sample is somewhat lower here, so there might be some fluctuations, but overall, I think it looks quite good. Of course, for the third quarter, a part is still ongoing. Those are the ones in light gray. But most of these should also still be delivered within the 35 days. So we should arrive at a similar figure as for the third quarter as we see for the second quarter of this year. There will also always be some that will take longer, among others, because we allocate assessments at the same stages, of the same standard at different stages to the same HUD consultants. So sometimes some HUD consultants have a higher workload, or there may be yellow or red lights which need some corrections before they can be sent back. So if you can go to the next slide. Yeah, what we do see across sectors and also for healthcare equipment is that the non-compliance rate, so the number or the proportion of standards of assessments that has a non-compliant outcome, so meaning the draft standard is not in compliance with the legislation, is high. So we see that across sectors, it applies to 3/4 of assessments that have a lack of compliance outcome, and for the healthcare equipment sector, that's the same basically. So this is something we see across sectors. This is, by the way, on assessments completed since October 2023, because before that we were using a different assessment template. So it's a slight break in the data, but also before that we saw similar figures. Of course, a key aim of the whole HUD project is to, and also of today's meeting, is to increase this compliance figure. So from the 21% that we see now to have a higher compliance outcome. You can go to the next slide. So what are we finding? So these are the main findings leading by the HUD consultant, leading to a lack of compliance in the assessment report. So what is actually leading the consultants? What do they find that leads them to conclude that the draft standard is non-compliant? You see Annex Z, not properly relating to relevant legal requirements of EU legislation, comes on top for the healthcare equipment sector. And so all these things you see here are not met, as I underlined here also. So these are the key things that a standard should consider, but is in this case not the case. So the second one is the Annex Z is sufficiently detailed, so is not sufficiently detailed in describing which clauses or subclauses support relevant EU legislation. As you can see on the next slide, the compliance rate improves across stages, and which is a good sign, of course. I think I would also argue that a non-compliance outcome at an early stage, at the committee draft stage or even inquiry stage, is not per se an issue. I mean, this is at that stage the standard can still be adjusted. And that's what the HAS system is aimed at identifying early on that there might be potential issues. But we would like, of course, to see then a strong increase across stages. In particular at formal vote stage, and we see these increases there, but yeah, I think we can conclude that it should ideally still be higher, the compliance rate at formal vote stage, than the 38% that is currently fully compliant at this stage. Although I think we can also add here the 7% that has minor issues, which can be some more formatting issues and stuff like that. On to the next slide. So the HAS project remains a project where we try to apply continuous learning. So we continuously try to improve the system further. Also, today's meeting is part of that. We have already taken many steps to improve the quality of the assessments and also the speed of our work. As was already mentioned, what we try to do is ensure the consistency of consultants, including by ensuring the same consultant carries out the assessment at this assessment on the same standard at different stages. We have improved the timeliness of the QR team, so that if there are any issues detected, they quickly resolve those with the HAS consultants. We are currently, and actually also see this meeting as part of that, trying to improve the coordination between the consultants, but also between the consultants and you as technical committees. So yeah, to increase the consistency, that's a vital goal for us. Increase the consistency among HAS consultants, also including through guidance and training, and by organizing regular coordination meetings. And I think a vital part of this is also to be in regular contact with the TC, so this meeting is a part of. And on the meeting request, so that's the last point. That's a more, let's say, operational point. So we have streamlined this process. We know that there were some issues in the beginning, but it should now be a lot easier to request a meeting. You see on the last slide here the process for that. I won't go through it in detail because I will hand over the floor to the HAS consultants. But please follow this criteria listed here, and then we should be able to arrange a meeting for you in time. And as mentioned earlier, you are definitely encouraged to request these meetings, because we think they can really contribute to the overall outcome. So thank you very much, and I hand over now the floor to our two HAS consultants, unless there are any questions at this stage.
Thank you, Dan. Thank you so much, and I can take the floor. Good morning, everyone, and thanks for the presenters for the previous presentation. My name is Daniele Lioy, and together with my colleague Christophe, we will show you some slides on the best practices and the recurring issues that we identified during the assessment in our health equipment sector. So basically, our goal here is to help to improve the drafting process, as the presenter said before, and so to ensure also a smoother compliance with the regulation. You will see some examples, so you will see some improvement tips, and of course we will be more than happy to discuss later on what we showed you, like the most recurring issues and topics we see during the assessments. So if we can see the next slide, I would like, before going to the major topic, having a little bit of digression, also taking the advantage of the wording from Mario before, by emphasizing how the harmonized standard plays a crucial role for manufacturer in first place, because many of you, all of you, are very familiar with the fact that the manufacturer need to demonstrate the compliance to the GSPR, and they have a certain number of tools to provide the compliance to those GSPRs. And other than common specification, also harmonized standard provided are a tool to provide a solution with presumption of conformity. So it's the link between the technical solution and the legal requirement to provide the presumption of conformity. So here we are all together to develop and to deliver a consistent standard to a manufacturer and also notified body to ensure that the whole process goes very smoothly. So usually this is documented in a table. I believe that you are very familiar with this, in which the GSPR are outlined and the method to demonstrate the conformity, the solution, which can be an harmonized standard, is reported. And of course, this table is important in deciding whether a standard contributes to a certain GSPR, and the manufacturer will include the harmonized standard in this GSPR checklist, and so the notified body will also evaluate it. And if the harmonized standard is written in a consistent way, in a clear way, it will be easier for both the parts to go directly to the point, to say this medical device is complying to the specific GSPR. And so we believe that providing consistent Annex Z and so harmonized standard is essential to help manufacturer, notified bodies, and all the parties involved in this process to come to the conclusion that the medical device is compliant to the GSPR. So apologize for this little digression, and now we can move forward to the core section. So Dan gave you a little bit of percentages of what are the boxes that are ticked when lack of compliance is provided. Now, the counterpart from our side is to give you some example of those topics. And majorly, we identified four major four categories. The definition of terms in a standard, the specificity of a clause referenced for the GSPR, the normative references, and some administrative, let's say, administrative issues. So, of course, another point to emphasize, these examples are just to give you an overview of how the GSPR, for example, was addressed and conducted to was connected to a lack of compliance. So basically, take this like an example to understand how to or how not to write something in the Annex Z. So moving forward to the next slide, we would start with the definition of terms in a standard and generally discussing about the status of these definitions. You know that the definition in a standard are essential to and a core, a pillar for the standard, for the technicalities included in the standard. It happens that this definition are overlapping with the legal definition included in the MDR, so in the medical device regulation, or in the regulation in general. So it was used to include in the template of Annex Z this statement that summarizing reflects the fact that if a definition in an harmonized standard differs from the definition in the regulation, then it shall be indicated in the Annex Z. So to let the medical device manufacturer or notified body also, or who uses the harmonized standard, understand how this definition supports the requirement of the regulation. However, we saw in many cases that even if the list of definition in partially or totally overlap with some of the definition imposed by the medical device regulation, these are not indicated in a separated table in the Annex Z. And so the first aim here is to emphasize you to check the definition in the medical device regulation with the definition set in the harmonized standard, and to clearly state the differences in the Annex Z in a separated table. So the differences in those definitions should be included in a consistent way. Moving to the next slide, please, we can have some points to discussion here. For example, you know that we already said it, when a term defined in the European standard overlaps and it's defined in the regulation, you need to provide a clear indication on which are the differences. However, the opposite, if a term is defined in the European standard, but it's not defined in the regulation, there is no problem. And it's also not legally relevant, of course. The term in the standard applies without any different meaning. So here we want to give you a practical example of two definitions that were explained in recent assessment that conducted to a positive feedback from the consultant. To be very clear, this table is not to explain how the definition in the standard should be adapted or interpreted to meet the requirement of the regulation at all, because of course harmonized standard must not interpret the EU legislation. We all know this. This table is meant to give you an understanding or a practical example on how the differences were explained in recent assessment. So as you can see, the definition were defined as substantially equivalent or identical, and the differences were claimed to be not impacting the legal status or in general the meaning itself of the definition. So a short take-home message for the definition part in these slides is to be very careful on the definition that overlaps between your standard and our standard and the medical device regulation, and define which are the definition differences and clearly stated in a table in the Annex Z. Concluding on this part, we can move forward to the second topic, which will take the majority of the examples, which is related to the specificities of the clauses, references for GSPRs. We wanted to start with not sharing an issue, but sharing some discussion here, because we found some different situation overall during the assessment. And the topic is GSPR from the chapter 1. You know that the GSPRs in chapter 1 of the Annex 1 of the MDR are very broad and generally are not addressed by a single standard. They are very, very generic. And so it's possible that potentially every harmonized standard could contribute in some degree to GSPR, for example, number 1, by providing information about the generally acknowledged state of the art. So the discussion here, the input here is to emphasize the fact that we should find together a solution to understand if these GSPRs can be considered addressed or not by specific clauses, even if they are generic and the clauses of the standard contribute to it for a very limited degree. Of course, we can give some exceptions, such as, for example, 14971 forest management, but the concept for all the other standard still remain. So whether GSPR from Annex 1, from Chapter 1 of Annex 1 should be referenced as being addressed by an harmonized standard, because they are very, very too generic. Moving to the next slide, another topic is when a clause reference to a GSPR, there is completely no match. This sometimes happens, and I will explain myself a little bit better. So sometimes happens that a clause, it's not easy to understand by the reader how the GSPR is being matched by the clause. One example, you can find it here in this slide. So when a statement in a clause is like, the information supplied shall include sufficient instruction on the use of indicator system, etc., etc. So sufficient information. And this is claimed to cover, for example, GSPR 23.1a, which requires the medium, format, content, legibility, and location of the label and instruction for use shall be appropriate for the particular device, etc. And in particular, instruction for use shall be written in terms readily understood by the user, and supplemented drawings and diagrams. So you know that the GSPR is very, very detailed and specific, while the clause is giving a technical solution, which is not a technical solution because it's just you need to provide sufficient instruction. So claiming this clause to address the GSPR 23.1 in this case, in this example, is not appropriate, simply because there is no match between you need to provide sufficient instruction and all the requirements in the GSPR 23.1a, because the technical solution doesn't match the legal requirement. So a message from this specific example, read very, very carefully the GSPR to understand how and in which extent the clause support the legal requirement. Then moving to the next slide, which will be my last one, and then I will leave the floor to my colleague Christophe. When we have a insufficient specificity for the clause to address a GSPR. Let's go directly to the example. The statement in the clause says the procedure of the EN 62366, which is standard related to usability, shall be applied to improve safety and the usability of the equipment and identify related risk. While the requirement, which was claimed to be addressed, 21.3, requires the function of controls and indicators shall be clearly specified on the device, where a device bears instruction required for its operation, or indicates operation or adjustment parameters, information shall be understandable to the user and, as appropriate, the patient. So in this case, which is slightly different from the previous one, you can see that the claim is that the clause reference to another complete body, to the complete body of another standard to address a GSPR which is specific for a specific topic. In this case, the clause is not giving a technical solution. It's just referencing to the technical solution of another standard. So actually, the reader, the user of the harmonized standard, should apply another standard to conform to this GSPR. So it doesn't make sense that this harmonized standard would be claimed to cover this specific GSPR because it doesn't give a technical solution. So the message here is that when you reference to a complete body of a standard and you want to claim the addressment of a GSPR, please be very careful because it could be possible that a technical solution is not completely given by the reference to a complete body of a standard. That said, I leave the floor to my colleague Christophe so that he can continue our presentation. And thank you so much, and see you in the Q&A session.
Okay, thank you, Daniele. So we go on to the next slide. And in this case, we're dealing with a problem where the reference or the clauses reference are simply too broad to actually convey a specific meaning or specific solution. So For example, if you have GSPR 6, which a little bit overlaps with what we addressed earlier, GSPR 6 is one of the very, very broad GSPRs in the chapter 1, which says something about the fact that characteristics and performance of the device shall not be adversely affected to some detrimental degree during the lifetime of the device, taking into account the stresses which can normally occur during use. And you then try to match this by saying, well, all of the clauses of the standard cover this requirement, then this is not a very, very specific solution to this topic. Not all the clauses of the standard usually address questions of durability or of the lifetime of the device, of aging of the device. It might be that there are more specific clauses that address this that should be referenced and should be focused on here to get a better idea which parts of the standards I actually need to comply with, I need to reference, and I need to later support with data to actually show that this GSPR is fulfilled, setting aside that this is a very broad reference and maybe it is more suitable to go more into the detailed GSPRs that come later on. Again, as with a lot of the things that we say here, there is no perfect solution. There are some cases where these kind of broad references, referencing more or less the whole standard or all of the content carrying clauses of the standard cannot be avoided. One example would be standards for sterilization processes. If I have a GSPR that requires sterilization to be done according to validated processes, I have a standard that in its whole addresses these validation processes. Then, of course, I will need to reference the whole standard or all of the clauses that are relevant to that, and I cannot avoid this kind of conjecture and this kind of connection, but it should be really the exception. Usually I should look for or ask the question, which are the specific clauses that deal with this specific requirements to get a proper match and to make it easier for the manufacturer and the notified body reviewing this to know what are we looking for, what are the essentials we are looking for, and not just generally saying, well, just look at all the clauses in the standard and you need to fulfill everything. This does not really help in applying the standard as a technical solution for a specific GSPR. Going on to the next topic, which is, of course, a variation of this, that it is unclear which part of a GSPR are addressed or not. So we are progressing here, so to speak. We have qualifying comments that try to lay out what are the limitations of coverage and what is covered and what is not covered. And there you often encounter the problem that it's not quite clear which part of the GSPR are covered and which are not, or that again you get difficulties with the match. For example, here you had the cited GSPR 10.1 was stated to be covered, but in fact the GSPR is relatively broad. It was addressed in part a singular subpoint of the GSPR, and even that subpoint was not covered for all of the defined chemical or physical properties, but or specifications, but only for parts of them. And then again, it should be clearly stated which parts of this GSPR are addressed and what are the limitations of the respective clauses in the standard. And this would also be helpful if it would be done in a consistent way. This is something that we also encounter, and is not a non-conformity or a problem per se, but is something that I think makes assessment as well as use of the standard later more complicated if the way coverage is indicated is done in different fashions. So in some standards, it's covered, not covered, partially covered with an explanation explicitly, if partially covered, which parts are covered and which are not. In others, it's more of a general text or more general descriptions, or the parts that are covered and are not covered are mentioned intervening in it, so that it's again not quite clear. So this would be helpful actually to look at. It needs to be clear from the qualifying comments: is this GSPR covered? Is it not covered? Or if partially covered, which parts are actually covered? Which parts are not covered? And this should be done across standards, if it is possible, in a consistent way to make it easier again for the reader to identify this and to get to a common pattern to identify this, because a manufacturer, of course, will need to review a number of standards. And if this is done differently in each case, it makes it harder to identify this and to properly deal with this and to actually work with this. Okay, going on to the next clause, which is something that is, again, maybe not technically a non-compliance in itself, but I think is something that defies the idea of harmonizing a standard, and is from example I've seen where the scope of the GSPRs are addressed and the referencing of clauses was kept to a minimum. In this case, it was an early draft standard, so maybe that's understandable. But nevertheless, in this early draft, you had a single clause for a single GSPR, and there even some subpart of the GSPR that was covered. And even though the standard dealt with a whole group of devices and without any doubt provided information on other GSPRs, no other clause, no other GSPR was cited. And while this is formally something where you can say, well, what is in there is correct, so I cannot say anything really from that point of view. Of course, it's misleading in the end. Because if I see the standard is harmonized and I assume that it contributes to different aspects of the GSPR, if it covers a whole group of devices and their design and testing requirements, and if then I find out in the end that just a single subpart of a GSPR is addressed by a single subpart of a clause, then this might be helpful for very specific instances, but it does not really represent what a harmonized standard should do. And this is not a good solution to encounter differences in interpretation with respect to the clauses. So as a solution to say, well, if we can't find common ground on what is covered and what is not covered by a certain clause and how these relate to us, just leave it out and to end up with a harmonized standard that really does not address crucial points. I don't think that is helpful for anyone. So the resolution was then that was proposed in the next draft was to just generally reference GSPR1 and saying the whole standard just contributes to everything, which is of course not a good way to address this. What we really need and what should be done is a consistent and clear indication which GSPR is addressed, which specific clause of the standard, and to get this as close together as possible without overly broad generalizations and without overly restricting the possible use you might have here. That as an additional point. So, and in the next slide, I think we come back to a general topic that's also always problematic, and we, in this case, condense this on a single slide because I think this is something that will be encountered in other sessions when dealing with the problems that might arise during the assessment, and that are the normative references, where we just some general issues listed here with respect to undated, obsolete references or references to drafts or even technical reports, which should usually not be done. So references should always be dated, or there should be a connection then in the Annex Z between an undated reference and a reference standard. And this connection, of course, should be consistent. So I recently had an example where you already had an updated ISO standard. The EN ISO version wasn't available yet, and the newer version of the ISO standard was connected to the older version of the EN ISO standard in the respective table in Annex Z, and this, of course, also does not work. So you need dated references that work, no obsolete references, and references to drafts sometimes cannot be avoided in an early stage, maybe. And maybe this is something where you just have to accept that this will lead to a non-compliance, and just then substitute at a later stage the draft by the finalized standards. And references to technical reports only work in very, very limited cases, but usually we as consultants, as HAS consultants, would mark this as a non-conformity, and this might be later on for the Commission to decide whether they would like to accept this in a specific case with a specific rationale or not. But these are, of course, always problems that arise. And I can see that in some cases, if you have only drafts available, or you have circular standards referencing each other, this can be problematic, especially for groups of standards. There's also the possibility to have a limited compliance, where you might say, okay, these are then published together, and this is then resolved in this way. Then also something that's, I think, important to see, that the reference should, if possible in any way, to a specific clause of the standard and not just to the complete body of the standard, if that is possible. If you just outsource everything that has to do with a specific topic to a different standard, then this is not a really helpful solution, I think, in this case. Usually you want to address specific topics which refer to a specific part of the standards. And that, of course, makes it easier for us as consultants to address this topic and to review this part of the standard. And it also avoids larger chains of standards where if I reference a complete body of a standard, this includes other standards, which then again would be checked, which reference additional standards, and you get a very long chain of standards that's impossible to keep under control. So wherever possible, reference to specific clauses of the standards where this cannot be avoided. And something that we also encounter sometimes is some kind of arbitrary choice in decisions. Of course, decisions or decision trees are something that's possible within a standards if they are clearly defined. So if the reasons for this decision, if the rationale behind this decisions is clearly defined and clearly given, but just saying you need a standard if applicable, or you need either the standards or some equivalent specifications, is too broad and too generic to actually give us a possibility to check whether this fulfills all the requirements, because it creates an arbitrary choice and leaves too much room to interpretation to have a consistent way of dealing with this. And in the last slide, I think some administrative issues, something that just has to do with making the work easier and maybe quicker if this is provided in a consistent way. The way we receive things sometimes is limited to drafted annexes in a package together with previous annexes. It's hardly, or it's difficult to identify which part is really relevant for us, and there is additional information on the standard missing. The naming of the drafts and the published standards sometimes is unclear, so we need to sort through the different documents and find what is the version we are referencing to. We have only the ISO version sent, and that's okay if it is clear which parts will later be added to this for the EN version. So one example would be the European forward, which is often missing in these cases, which is something that probably will not make a big difference or will not be problematic, but there is a point within the checklist where I need to check as a consultant whether the forward, and that includes the European forward, contains any requirements or additional content that should not be included in the content. It is very, very probable that it is not the case, but if I don't have access to this document, I cannot assess it. I have no possibility to do that, and I cannot say, well, this is given. So this would be helpful. And then sometimes there has been an older version of the draft and not the revised version, which of course doesn't work out. And something that usually would be helpful, especially for repetitive or for additional or recurring assessment, would be if changes from the previous draft are clearer. I think we talked about it in a meeting earlier this year, that it is sometimes problematic and that it's not easy to do this from a technical perspective, but it would be good to have a solution to see what are the changes from the previously draft which reacted to the previous assessment results. And usually this is done very well in the tables also, that you get answers. But this is something that also you can look for, that it becomes clear for us if this is during the ongoing assessments, what has been changed as a reply to which comment by us, and how was this adapted. And this should be visible within the documents we receive. Okay, and with that, I think the next slides are just summarizations, or it's just a summary of the points we addressed. That's just something that's put together for reading, I think, later on. And I think I would prefer to go to the question and answer sessions instead of going through all these points again. So thank you for listening. I hope this was something you can relate to or of interest to you, and we can try and address as many questions as possible.
Thank you, Christophe. Thank you, Daniele. So I propose indeed we open the Q&A session. I'm checking already in the Q&A chat. There are some questions. I addressed some of them in a written way, but let's go through them and we can answer some of them live. So please, if you find a question now that you want to address, please go ahead. And please, Dan and Emilia as well, if you see questions that are addressed to you, please jump in and take it.
Yeah. Okay, maybe I can start with one question here. Have only definitions to be included that are available explicitly in both the regulations and the standard, or has the TC to do guesswork for implicit definitions? No guesswork is required. So the topic of definitions is actually limited to the legal definitions versus to the explicitly stated definitions within the standards. That's the issue that should be addressed. And again, there should be some consistent way to address this. However this is done, there's no really right solution anywhere. So the table we showed with the explanation of the differences is something that I think came up in the CENELEC cookbook or in the draft for this cookbook where this table was present. This is one possibility to resolve this. There might be others, but whatever possibility is chosen, it should be, again, consistent across standards, I think, to make it easier to deal and to work with this. And the important point is that in some way it is indicated where there are differences in the definitions, because there, of course, you might have problems in interpretations, but only legally defined or legally represented definitions, not anything that might implicitly come up because of the use of words in the rest of the standards or in the regulation.
Yeah, I can also read the subsequent question here. When a standard covers only a part of the GSPR together with another standard, which is not maybe yet harmonized under the MDR, only under MDD, what should be indicated? Based on my personal understanding, you should clarify how the clause is addressing the GSPR for that specific future harmonized standard. So you should not relate it to other harmonized standard when you say it's partially or completely addressed. So it strictly depends on how you think that clause is addressing the GSPR, not with
Yes.
another standard.
So yeah, I agree. And in this case, I would say it's partially covered. And for example, if you have something addressing specifics of biocompatibility testing and certain risks that are specific to this type of device, then you can state in this case, well, this covers my biocompatibility requirement. Partially, it addresses risks that have to do with, I don't know, this and that specific property, and it does not address risks that go beyond this. And then everything else might be part of a general biocompatibility standard or whatever, but it becomes clear, I think, from the comment that which risks or which parts of this are specifically addressed by the standards I'm having here. And you should avoid, just for clarity, within the Annex Z and the Annex Z tables to reference in the qualifying comments any other standards. That's not the part to do that. Yeah, so the solution is not then to say these other points are covered by 1093-1 or whatever. This is something that should be clear from the text or from the table or whatever. But here it is about the question, what is covered by the standard I'm currently looking at?
I will take a question from Regina. Sorry if I misspell your name, but it's a question about if we can have a TS or a TR as a harmonized standard. And I replied to the chat, but the answer is no. And maybe, Mario, if you're still here, you can complement, but a harmonized standard can be only a European standard. One of the reasons being that a European standard is a standard that is that all the national members in Europe have to apply that standard identically. A TS or a TR doesn't have that obligation. So an EN have to be adopted by all the national standardization bodies in Europe. And that's why only ENs can be harmonized standard. I will put a link to a page from the European Commission in the chat related to that. But if Mario, you're still here and you want to complement, please go ahead. Thank you.
So I can see also how can more EN 60601 2XX harmonized standard be generated for specific medical devices? What has prevented so few of these harmonized standards from being recognized as harmonized? I don't have the full picture, to be honest. What I can give as an input here is that sometimes this type of standards are being affected by references issues. So cross references or a chain of references that may affect the harmonization status, or for example, they could be affected by the topic we discussed today in this webinar. So I cannot give you a specific answer, but I believe that the topic that we addressed today could be also relevant for these specific ISO standard, EN standards.
Yeah, and I think there is a comment by Regina right next to it, also saying that there's a lack of experts willing to write the annexes necessary for harmonization under the MDR, which is of course a problem we don't see or don't have any influence on. But this is of course something that might be problematic because you need, of course, someone to take care of this. And ideally, you, of course, develop the annex set alongside with the standard. That's the same as with the design and development of devices. If you do not consider the requirements that might need to be addressed during design of your standards, and then only go later on with the finished standard back and compare what might fit and what might not fit, that's problematic, and that's a difficult thing to do.
Yeah, I completely agree. Yeah.
Yeah, and there's a comment by Susan saying it should be discussed in CCMC to include an official table to differences of definitions, because the TC is normally not allowed to change the template of Annex A. That is, I think a good idea and a good way for you to handle the fact that this is done in a consistent fashion. Again, that's for you in the end to decide how you would like to handle this and how you would like to address this. But this was something I think that came up, that the definitions were explicitly mentioned in the template, and there was no explanation, and maybe to adapt the template and include some kind of standardized, consistent way to deal with this is a good solution and a good idea to deal with that.
Yeah, thank you, Christophe. I wanted to address this question as well. And yes, thanks, Susan, for your question. And indeed, this is in our radar. I think we can do better in terms of definition. So instead of having that into the Annex A, I think we should work on having a solution. But yeah, this is on our radar, and we will start working on it. Yes. I will take a question from Regina. I don't know if it's a question or if it's a statement. It's about OSD. When the standard is developed in OSD, the European elements are in OSD. And so I don't know if it's a question, but indeed, we are working on our side as well on OSD. Today, harmonized standards are excluded from OSD because there are a lot of applications to address before we can use OSD. What we can do today, though, is to extract the draft and the European elements and to provide that as a PDF to the HAS consultant. So even though your standard is developed within OSD, I think there's still the possibility to request an assessment by extracting the needed elements to be able to provide them to the HAS consultant.
Yeah, and okay, there's a comment by Burkhard on something I said, and that's of course understandable that the IEC standards are developed with international experts, and parallel development of an annex set is not realistic because they focus on the general problems and not on the Europe-specific questions, which of course makes sense. This is something that is a general problem within the international development of standards. Oh,
No, this is This is another question related to normative references to international publication with their corresponding European publication. If the EEC refers to an outdated EN
Yes.
edition of a standard, meanwhile the new EN is published, what should be the right reference?
That depends actually. If they have a specific reference to an outdated standard and rely on the content of that standard, then you of course cannot mend this with the Annex Z. So you cannot simply go and say, well, they referenced a dated older version, so I just substitute this with a new version to be up to date, because you don't know what was referenced. You would need to check whether there are differences in the standards. So this does not work. So if there is an explicit dated reference in an IEC standard to an old EN version, I think that's simply a problem you have to live with, because they definitely referenced to a specific version of the standards and probably had reason to do so. You cannot fix this within the set annex, I guess.
The only way, Christophe, the only way to fix that would be to go for a European amendment, a European common modification. That is an A11.
Yeah. Okay.
Then it's up to the European TC to assess if this is possible and if they want to go that way. But there would be a possibility to amend the IC text through an A11.
Yeah. Okay.
I will take the question from another one from Bukart about, I don't know if we addressed it, about IAC developed in parallel and with the international experts and the drafting of the Annex Z. Yes, that's true. It's challenging because the text itself is developed at international level, and the international experts, they don't care. Exaggerating, sorry, a bit, but the Annex Z should be in the remit of the European experts. And here I insist again on the importance of the cooperation and coordination between the European TC and the international TC, so that the Annex Z can be drafted by the European experts, possibly with the help of the international experts. Something important here, it's about I didn't say for the new process for parallel development. We are busy working on the implementation of a new thing is the HAS assessment report will be circulated to the international TCs as well for information, so that they will know why maybe the European experts are asking for some changes to the international text. Thank you. And Stephanie, your comment that it makes sense for the IC committee to help draft the Annex Z, exactly. So it really makes sense to coordinate between the IEC and the CENELEC TC, so that the Annex Z could be drafted together. And again, I insist on the importance of starting early, because in the statistics we saw that at the end we still have a lot of compliance issues. And if you start earlier, I know it's not always easy, it's challenging, but if you start earlier, I think you increase your chances of having an Annex Z ready early, and so having the Annex Z assessed by Christophe and Daniel and the other HAS consultant, and this will give you the opportunity to have an exchange with the HAS consultant early, so that the issues are addressed as early as possible so that at the end, everything is okay.
Yes, I think that's something that's difficult to get right. The earlier you start with it, the better it is. On the other hand, it needs some content to you, so you are able to work with it. So there are some points I think where you can just accept that it will be a non-compliance, like if you reference another draft standard that's not yet ready and you know it will be available at the moment you get to a later stage in the standard, that's unproblematic. But for other things, I think it should already be as good and as close to the end solution as possible. So just to have something to start off and have a more or less empty table is not bringing this discussion forward. We need content to work with so that we can start early to discuss things out. And that's a difficult line to go while at the same time drafting the standards and having a lot of work to do on top of that. I can see that, of course.
I'll take a question from Ben Cox about the common modifications. It's true that it's mostly for IEC standards, and there are not that many for ISO. But Ben, I will invite you to contact your CCMC project manager. He or she will be able to better support you with your question. Thank you.
So at the moment, I think the other points are technical issues I cannot really contribute to or comments that work for me.
Or just confirmation, exactly. Me too.
Yeah, maybe since this is a dialogue, the other way around, if you get the comments from us, what are things that you would say we could make better, or how could we be clearer in the problems, or is this something where you say no together with the comments? It's usually clear what is meant by the HS consultants, or are there topics where you would say this is something that should be or could be handled more consistent from our side, or could be handled more helpful for you on the other side? Okay, so at least no immediate response.
Yeah, exactly. Maybe they need to think about it, of course.
Yes.
I will answer a comment from Regina about the fact that she cannot influence the system so that the standard appear. I guess you mean the standard appear early enough in projects online. If you have difficulties or challenges with that, I invite you to contact your CCMC project manager to see why the work item you need to appear is not there. We might have an issue on our side, so please contact your CCMC project manager so that when the work item is created at ISO, it appears at the same time at CEN so that you can request an assessment on the CD draft when it's available. So please contact your CCMC project manager because there must be a way for the work item to appear on projects online. Thank you.
Yeah, okay. I think I can say something about the comment by Susan. Okay, good to hear that the comments are relatively clear. Recommendations for solutions are always difficult and something that's a thin line for us to travel, because we can try to provide a general idea how we think this could be solved, but we cannot really present a solution. We cannot participate in actually phrasing or wording or in writing that annex of the standard. So this is something where I hope that where we can try to find a good idea to clarify what we would expect from a solution. But concrete recommendations are difficult, because this is something we need to refrain from to keep sufficiently independent for further reviews. And yes, contacting the CCMC or the TC if some documents are missing, this is something we are doing. We have forms for that, and we try to do. And usually, I think we will not reject an assessment, or we will not rule something non-compliant or problem if we did not try to get the respective document. So this is something that I think none of the consultants would do, just check some box saying not compliant without first reaching out and trying to get the documentation. Just for example, with the rather formal aspect of European forwards, there really was no way to get it. It's not that I just stated it's not there and didn't request it, but I tried to get it and didn't succeed.
And if I can complement, yes, so sorry, Christoph, go ahead.
No, but that's I just wanted to say, but that's of course something that makes sense. We usually try then to reach out and get the documents. Yes.
Thank you, Christoph. And just to complement, I confirm what Christoph just said. Often has consultant contact EY and then us to get access to a missing document. And I wanted to say that we are in a close contact with EY. We have coordination meetings every 2 weeks, and we have contact every week about this type of issues. If the document is missing in an assessment package, the has consultant contact EY. EY comes to us. We are very reactive because we don't want them to be blocked, so that you can receive your assessment report on time. So yes, we are doing that, closely following that, and we have a close contact with EY to really smoothen the operations and to allow everyone to work at its best capacities. Thank you.
Yeah, and in terms of the forward, no, I think it was at a later stage, but good to know that there are stages where there's no European forward, and yeah, in this case.
And yeah, a comment about the European forward. So we create it only at the end. Actually, the European forward is created by the editor only at the end, almost when the draft is ready to be made available. So this is at one of the last steps. So you will, for example, at inquiry, you will not have it. You might have it at FDIS, but at inquiry, definitely you will not.
Yeah, okay. Makes sense, yes. Okay, the available of the common checklist and CCMC guidance document. This is, I think,
for Frederick, I believe.
Yeah, I will put it in the. So we will share the presentations. In the presentations, you will have a link to all the documents, to a lot of webinars, and I will put as well in the chat now a link to the boss page where you can find all the guidance documents, and as well I will put a link to the common checklist. But again, we will share the presentations, and all the links will be available in the presentations. Thank you.
Hello, Frédéric. Can I please suggest to launch the poll, feedback poll? It's just a short poll asking the attendees their feedback about this webinar in order to improve our webinars in the future. So if the remaining attendees can please submit their answers to the 3 short questions, that would be helpful for us. Thank you very much. And I just wanted to remind the attendees also that we have recorded this webinar. So the webinar will be made available on the CEN and CENELEC website, and you will be informed when it's available. We will upload the recording together with the presentations. I see that 100% of the attendees participated to the poll, so I'm closing it now. I don't know, Frédéric, if you want to wrap up at this point.
Yes, so if there's no further questions, I propose we close. Let's wait a couple of minutes to see if there's no other question popping up. So again, the slides will be shared. You will have a link to all the documents I was talking about, so the guidance documents, the common checklist, all the webinars that are that were organized in support of drafting standards, the normative references, and so on and so on. Everything will be shared, and we will soon, as Mario was saying at the beginning, we will soon organize other sessions in support of other legislation. The next one is LVD, somewhere in November, and then we are busy working as well on preparing one for machinery, and others will follow. So if no further questions, I would like to thank you, the presenters. Thanks Dan, Emilia, Iwa for your support, Christophe, Daniele for your work and your presentation, Vaclav for your support behind the scene. Thank you all for spending this morning with us. I hope this will be useful for you. Don't hesitate to come to us should you have further questions. Contact me, contact my team, contact your CCMC project manager, and I will see you soon. And thanks again for your time this morning.
Thanks, Frederick, also. Thank you, everyone.
Thank you,
Have a nice
Frederick.
day.
Thank you. Thanks for organizing this.
Bye-bye.
Thank
Bye-bye.
you.
Bye.